Good evening. Peter Hubby coming from Serotonin Milkshake. This episode is how to solve the problem of anxiety and depression and fear around surgery, actually, tonight. I have surgery on Thursday morning. I'm having a arthroplasty, complete shoulder replacement on my left shoulder. So I wanted to talk about that and the fear that might come around that when people have to go in for an operation. So basically, I did some research on this, and we just want to make sure that people aren't having huge anxiety when they go in, for one of these procedures. I was a little shocked when I found out the news, and I really didn't want to get this done. But, I found out that, a lot of us, are having, have to have surgery along the way in our life. And so I wanted to address, this is my episode, probably the last one before my surgery, and I won't be able to, put up another video until afterwards. And so I wanted to make this one count, and I wanted to just help people that are in fear of going into the hospital and going under the knife. So I have done it twice, and it has been fine. I had a tonsillectomy when I was 17, and then in 2015 I had lower back surgery, and that was crazy as far as like what they had put me under with. So all kinds of crazy ingredients with that anesthesiologist. I guess now they can make medicines that can, make you forget the procedure. And, I was talking about the intubation, which I might have a sore throat afterwards. And I was like, oh my gosh, I don't even want to think about that. So I thought it would be helpful tonight to share on, fear and anxiety around surgery and to help people cope through that. So probably the best thing to do would be able to talk to your surgeon and understand, the plan, because you don't see him or her that often. Maybe they can help you calm your anxiety. Prepare with a prehab program. The prehab is exercising, improving nutrition, and creating mental preparedness. Try alternative remedies. Some patients find relief from acupuncture, massaging, tapping, that's an interesting one. Yoga, hypnosis, biofeedback, and herbal supplements. So, listening to music, reading a book, talking your mind off of what is about to happen can help alleviate anxiety. So, this show in and of itself, it helps me as I share with you what my life looks like and what I'm going through. And if it can resonate with your life, then that's fantastic. And that's the exact meaning and purpose of this channel. So practice self-care, get enough sleep, eat well, and exercise within your ability. So I have to get up at, on Thursday morning, it was changed from noon to 8 a.m. So I have to be at the hospital, which luckily is just only a couple of miles down the street. I have to be there by 5:30 in the morning. So I'll be ready. So tomorrow night's the night that I have to sleep beforehand. But it's typical, basically, I think, if you have an intense fear of surgery, I think they say you're a minority. There's a lot of patients who have, psychological phobia around this, fear of spiders, fear of flying, fear of lizards, and these are real pathologies. There are some patients who are afraid they won't wake up from surgery, or they will wake up during surgery, which is an extremely rare phenomenon. I can't imagine that. I certainly wouldn't belittle any patient who has these fears. This is coming at you from Yale MD's name for fear of surgery, which is actually called tomophobia. I thought that was pretty interesting. But patients go, they go into surgery and they often have a generalized fear and generalized anxiety of the unknown. And, you're going to lose control, where you've previously had control in this Neverland, this never ever land that you're going to go to. And It's unrecognizable and can sometimes be exhibited as pain. And women also have a lot of stressors too. But we have, we got a family to make sure that our children are doing well. Maybe lean on your family a little bit. I know my parents are going to be involved and very supportive on Thursday. So that's a good thing as well. Onward, if you want to basically, psychology and psychiatry, they're part of the pain portion of the condition. So the physician's trained, the patient's anxiety after surgery, they could have looked like pain symptoms, but they're treated with pain medications because anxiety was not immediately obvious. So I've got all this covered personally, so I'm not worried about any of that. But we need to remove the stigma that's associated with anxiety or depression, right? So this is all part of the surgery conversation or any psychological issue, right? This website promotes telling patients if it was your heart, you wouldn't think twice about going to a cardiologist, right? So it would be ideal if we could screen all of our patients for these issues before an operation, but that would also help us better care for them after their surgery. So there's a whole plan that should be in place for this type of phenomenon. But I also read that the anesthesiologist, if you talk to them, that's a good conversation to have. I certainly did. It's they'll tell you, and according to this online report, that anesthesiologists have helped to increase the safety of surgery. And anesthesiology is one of the safest fields in medicine. So they monitor the patient so closely. They take precautions, and they've got data and scientific evidence to show that the risk of the patient in the hands of a physician anesthesiologist is low. So, they've developed policies and protocols that are evidence-based for patients with heart disease, diabetes, difficult airway, and other problems. And we've studied and continue to study all of these things to make sure surgery is better and a safer experience. And so that makes me feel good. If you saw the diagram that I showed earlier when I first started this show, it was, when I first did the research, it was a little, I was a little set back. It was a little shocking, to see, what type of metallic stems and balls are going to be going into my, my physicality. I've never had, or my physical body, whatever you want to call it. I've never had any metal or any foreign devices placed in my body before, so this is totally new to me. But there's a lot of things they can do if you're in pain. It's important to remember that the anesthesiologist is really a perioperative physician, which means they provide care before, during, and after the surgery. So it's a whole journey and a process for these people. They start working with you before the surgery to determine how they'll treat your pain throughout all of these phases. So, and they did that not very extensively with, not to mention, the hospital that I'm going to, but that's another conversation and another show. So many people are familiar with the spinals and epidurals. I'm actually having one on December 3rd. My left leg is just ridden with, I take pregabalin, basically for the nerves for permanent sciatica that I have in my left leg, which was left over from the 2015 back surgery. But many people are familiar with spinals and epidurals, and they still use those techniques, when it's necessary. But they have a lot of other tools in their toolkit in the surgery suite. For example, they have a nerve block, and I'm getting one of those, which, cuts off, I guess, like an entire piece of your, your nervous system to that particular area, which is, that sounds fantastic, actually. And so I'm going to get one of those. But a local anesthesia, that's the definition, that it blocks the transition of pain messages to the central nervous system. So it can profoundly reduce pain in the area being worked on, but not the rest of your body. And there are many varieties of blocks that they can do now. So even breast surgery. So it's an exploding field, as they write. Anyway, so just don't worry. You're going to be fine. It was a crazy wake up on my 2015 surgery, and I was like all over the room, and I didn't know, what was going on, who was in there. I just saw these white figures, and they were blurry, and I think my parents were in there. I think like 5 doctors were in there because they hadn't particularly done this operation many times, because they're all different. All back operations are probably different. And, I had basically, the nerve was basically kind of pressed up against 3 vertebrae. And so what they did was they shaved back some of the vertebrae so they could reach so my nerve could be in more of a free-flowing state without that penetration, which actually brought me to my knees. Actually, I just it was a bad situation, but I'm glad I had surgery and everything was great afterwards, except that one issue. So like I said, I'm going to go and get an epidural shot with my doctor on December 3rd, and we'll see how that goes. But so just relax. Like I said, you'll be fine. To me, it feels like 2 seconds, when you're counting backwards and the gas and the medicine is going inside you, and you get to about maybe, 9.5, and then you're out, right? And then 2 seconds later, you just wake up in this, this crazy condition where you've been operated on and stitched up, and I'm sure completely analyzed and regarded as healed, I suppose. And but you had nothing to do with it. Like you were absolutely unaware of everything and had absolutely no say whatsoever, except in the beginning when you went to decide on getting, that surgery, right? They said, hey, listen, Peter, you don't have to worry about getting shoulder surgery if you don't want to. You can just let it, develop on its own and grow old with it. And, there would be all kinds of problems with that. I would imagine in any orthopedic situation with any bones or muscles or nerves that anybody has issues with. I don't think you want to do that. I really I don't think you want to do that. I think you want to get it fixed. I was able to be young enough to be able to take the full arthroplasty, which is like the 4th stage of the entire entire procedure. It wasn't like they were going to go in and just do something light. They wanted to go in and just, replace the whole thing. And they did that because I was young enough and I was healthy enough to be able to endure that kind of surgery. So that's the reason why it's pretty drastic. But like I said, to my viewers that are listening, I just want you to know, have comfort, and then just know that it's safe and they know what they're doing, and they are highly skilled in monitoring, every aspect of your vitals when you're under. And like I said, I enjoy meeting the people. I appreciate the bedside manner. I want them to be there. I don't want them, if I don't see them, they're not gonna be in the room for me. I mean, that's just the way it goes. And I also require a smile. As it pertains to this show, it has to be steeped in joy and happiness. So I require a smile, and I got a smile from the surgeon. I said, okay, fine. I said, you're the guy, you can do it, that's fine. And if he has to do it alone, that's fine. But I met some other folks that are going to be, around the surgical suite, and, they might have the day off or something. But, I don't want to hear about that. I just want to know that everything's going to go fine, and I'm the patient, and you would be the patient, and you just need to know that it's going to be okay. So, anxiety is normal, as it relates to the anesthesia, which is, frequently rooted in feelings of, unease, tension, and nervousness. So patients can encounter a sense of, losing control, when they go under. So feeling vulnerable to the healthcare staff during the procedure, that's totally normal. It can lead to, heightened anxiety and potential impact to the patient's surgical experience. So take a deep breath and just let them do their job, and, go with God, I would say, because you're in the hands of complete professionals, and they know what they're doing. So, and you get to interview them and vet them beforehand anyway. I had to have 2 physicals and 2 dental appointments and wait 3 weeks after the last dental appointment. So this was like, a multi-step process to get me to Thursday, because they had to make sure that I didn't have any any kind of infection going on, inside my mouth, which was crazy, which would, affect obviously, the blood system flowing through my body. So they wanted to make sure that I was good that way. So I'm good. And they will tell you everything that they need for you to feel comfortable about getting a surgery. So that's the topic of this show, is to help people who have anxiety and fear around going in and getting a surgery procedure done for themselves. So, a significant contributor to the anesthesia anxiety is, this loss of control, but, they commonly experience just a general fear of the unknown, and the possibility of losing control during the anesthesia, exacerbates their anxiety, especially in the operating room. Uncertainty surrounding anesthesia can intensify patients' acute procedure anxiety and results in a range of adverse outcomes. And so this is, it's basically, the numbers are very comfortable, when you talk about these numbers. So anyway, we get hyped up. We are kind of our own worst. I mean, I know that I have kind of a self-destruct button built inside of me, basically, that, as soon as I start a fear, a thought of fear, basically it just kind of rolls into this snowball effect of, picking up all the kinds of different emotions and, other types of anxiety, which, I just don't need. So I just try to cut it out right at the beginning, whereas I don't have to worry about these things. But it's prevalent. It's largely unfounded as an actual risk of this happening. If you getting in trouble in the surgeries is extremely rare. So it's less than 1 in 100,000, making it an unwarranted fear for the majority of patients, including elderly patients. That is basically regaining consciousness. Those are the numbers. Basically, the potential of experiencing pain during anesthesia is another prevalent fear. So the incidence of these occurrences relatively low, with awareness during general anesthesia happening at a rate of 1 to 2 per 1,000 patients. So I know that I told my surgeon for the pre-op, I told him, I said, I want to be as far under as you can possibly put me. I want to know nothing. So I want to know nothing. And anesthesia awareness itself occurs only 0.1 to 0.2%. So finally, any kind of allergic reaction fear you might have might be another concern for you, but they're infrequent, and they have the significant reactions occurring approximately only 1 in 10,000 to 1 in 20,000 procedures. So basically, contrary to common perceptions, anesthesia is generally very safe, and its continuous advancements in technology and monitoring have made it safer than ever. The estimated perioperative complication rate ranges from 3% to 16% in industrial nations. So the protocol set in place to minimize risks during anesthesia administration includes systemic approaches towards reducing risks, controlling infections, and managing patients properly, minimizing any kind of potential that they would have. So, my friends,